This program is rated SPG. It contains scenes with themes, language, violence, sex, horror, or drugs which may not be suitable for children. Strong parental guidance is advised.
Regret. Regret is always in the end. I regret that happens to me. Being pregnant in an early age is not my decision and it's not my choice. And I can't control what will happen in the end. So let me share my story.
Hours later.
As we promote the different types of artificial contraceptives.
Depo-Provera. Depo-Provera is a very effective form of birth control, and people who use it doesn't have to remember to take a daily pill. It is a well-known brand name for medroxyprogesterone acetate, a contraceptive injection that contains a hormone progestin, and also it is given as an injection every 3 months. Among various benefits of Depo-Provera, first, doesn't require daily action. Second, eliminates the needs of interrupt sex of contraception. Third, decreases menstrual cramps and pain. Fourth, lessens the menstrual blood flow and in some cases of menstruation. And lastly, decreases the risk of endometrial cancer. There are side effects associated with Depo-Provera: irregular menstrual periods or no periods at all, which is safe benefit of the shot. Headaches, nervousness, depression, acne, change of appetite, and weight gain, and excessive growth of facial and body hair. And there is the side effects of Depo-Provera. And that's all. Thank you. IUD, intrauterine device. What is IUD and its type? The device that includes hormones levonorgestrel, a type of progesterone better known as Mirena. The release of the hormone is low. It keeps the lining of the mattress from being uncomfortable for the baby to implant. It can last for 3 to 5 years. And the device does not include hormones or copper IUD. This type of IUD interferes or prevents fertilization of the sperm in the egg cell of the womb. Its validity can last from 5 to 10 years, up to 12 years even. What are the advantages and disadvantages of the IUD? The advantages. First, the IUD can be used for those who are breastfeeding. Second, very effective and safe to use. Third, it does not affect with the patient with taking other drugs. Fourth, although the string of the IUD can be felt, it does not interfere with intercourse. Fifth, the Mirena IUD, the one with hormones which is progesterone, reduces bleeding and pain during menstruation. And lastly, number 6, unlike the other contraception, the IUD does not cause headaches, acne, breast pain, irritability, depression, vomiting, heavy weight, the accumulation of the body, blood of the body, and it also increased the risk of having a cancer like breast and cervical cancer. But it is possible to give birth with IUD protection against breast and cervical cancer. And the disadvantages of the IUD. First, this is because the foreign body, there is a risk of infection, but it is 1% according to the study. Second, there may be the damage of the uterus or mattress in 1 in 1,000 IUD users. Third, the copper IUD has strong bleeding and pain or dysmenorrhea when there is menstruation. Fourth, the Mirena IUD can cause irregular or light bleeding or spotting. Fifth, can have an allergic reaction of the copper IUD. And lastly, number 6, if you had an IUD and get a transmitted infection, it can get a worse and end up with a phobic inflammatory disease. That's all. Thank you.
The contraceptive implant. It is a small flexible plastic rod that's placed under the skin in your upper arm by a doctor or nurse. It releases the hormone progesterone into your bloodstream to prevent pregnancy and last for 3 years. Risk factor of the contraceptive implant: pain in the back or stomach area, changes to your period or maybe stop completely. This is called amenorrhea. Higher risk of non-cancerous or benign ovarian cysts, lower sex drive, dizziness, headaches, mild insulin resistance, mood swings and depression.
Combination pill for birth control, everything you need to know. If you're planning to become a sexually active but don't want to get pregnant, this is the right place for you to get a medical advice. Hi guys, today we're going to talk about combined contraceptive pills. First, what is a combined contraceptive pills? As the name suggests, a combined contraceptive pill is a combination of two hormones incorporated in a pill that helps you in preventing the pregnancy. These hormones are estrogen and progesterone. Let's see how it works. Hypothalamus and pituitary are the two endocrine glands in our body that produce these reproductive hormones in a psychological manners. This process follows a regime every month to make an egg and prepare the uterus for the pregnancy. Now, what happens when you take combined oral contraceptive pill? When your doctor gives you a pill with both estrogen and progesterone in it, that we call a combination pill, your body gets these hormones from an outer source in a consistent manner. Your body realizes that it doesn't need to follow the cycling pattern to produce hormone. It does not ovulate. No eggs means no fertilization and ultimately no pregnancy. Type of contraceptive pills. Now there are different types of combined contraceptive pills in the market based on hormone concentration. The most common among these are the monophasic 21 days pill and the other one is the basic 21 days pill. Both of these are be taken for 21 days daily followed by no pill for the remaining 7 days of the month. The only difference between this pill is concentration of the hormones. Monophasic pills have an equal concentration of hormones in each pill while the basic one has different concentration of hormones. Indicated by multiple colors of pills in the pack that have to be taken in orderly manners. Other type of pills are every pills that has pill for the whole cycle pills and 7 SIBO pills. These pills should be taken without any precautions. Usually, taking the pill at the same time every day is the most effective and assuring way of preventing pregnancy. If you miss the pill by 6 to 12 hours by any cause, this is a risk of waking your hormonal cycle. Once your cycle wakes up, it will release an egg for the time. And trust me, you don't like unwanted pregnancy, so take your pill at the same time daily. Some oral contraceptives are prohibited in certain medical conditions like depression, migraine, hypertension, and breast cancer. Busting myth. Some of you may have heard that once you get on a pill, it will disturb your reproductive functioning, making it difficult for you to get pregnant in the future. And that is myth. There is no such thing like that. Remember that if you miss your pill for 12 hours and your psychological hormone cycle may wake up and deliver an egg for you to cry for an unwanted pregnancy. When you stop the pill, your body will slowly come to its physiological nature and rhythmic ovulation cycle every month. It would be all blood bath in your uterus again. Thank you.
Condoms protect against STI, what spread via discharge, such as HIV, gonorrhea, and chlamydia. Condoms play a crucial role in sexual health by providing both positive and negative effects. On positive side, they can highly effective in preventing sexual transmitted infections and unintended pregnancies. Condom also empower individuals to take control their reproductive health. However, some may argue that they can diminish spontaneity and intimacy in sexual relationships. Balancing these aspects, the overall impact of condoms is positive, promoting responsible and safe sexual practice. The disadvantage of condoms is can cause irritation of allergic reactions, and the advantages of condoms easy to use and no side effects. Spermicides, chemical agents designed to embolize to kill sperm, have both positive and negative effects in the realm of contraception. On the positive side, they provide an additional layer of protection against unintended pregnancies when used in conjunction with other contraceptive methods. Spermicides are available in various forms, including cream, gels, foams, and flexibility in usage. However, their effectiveness can vary, and relying solely on spermicide may not be as reliable as other contraceptive methods. Negative effects include potential irritation or allergic reactions, which some individuals may experience. Additionally, spermicides do not protect against sexual transmitted infections, emphasizing the importance of combining them with better methods like condoms.
Contraceptive patch. The patch releases a daily flow of hormones through the skin into the bloodstream to prevent pregnancy. It contains the same hormones as the combined pill estrogen and progestogen and works in the same way to preventing the release of an egg each month. Ovulation. How does the patch work? The same way as the pill stops ovulation, thickens cervical mucus.
The vaginal ring or Nova ring is a small soft plastic ring that you place inside your vagina. It releases a continuous dose of the hormones estrogen and progesterone into the bloodstream to prevent pregnancy. This is the sample picture. At a glance, fact about the vaginal ring. If used correctly, the vaginal ring is more than 99% effective. One ring provides contraception for a month, so you don't have to think about it every day. You can continue to have sex when the ring is in place. Unlike the pill, the ring still works if you have sickness, vomiting, or diarrhea. The ring may ease premenstrual symptoms, and bleeding will probably be lighter and less painful. Some women have temporary side effects, including more vaginal discharge, breast tenderness, and headaches. A few women develop a blood clot when using the ring, but this is rare. The ring can sometimes come out on its own, but you can rinse it cold or warm water and put it back as soon as possible. It doesn't protect against sexually transmitted infection STIs, so you may need to use condom as well. How the ring works. The ring steadily releases the hormones estrogen and progesterone into your bloodstream, which prevent the release of an egg from each month. It also thickens the cervical mucus, which makes it more difficult for sperm to move through the cervix, and thinnens the lining of the womb so a fertilized egg is less likely to implant itself.
This is contraceptive sponge. The birth control sponge, aka the contraceptive sponge or the sponge for short, is a small round sponge made from soap, squishy plastic. You put in a deep side on your vagina before sex. The sponge covers your cervix and contains spermicides to help prevent pregnancy. So the sponge is realistically 86% effective for women who've never given birth. 14 out of 100 sponge users who've never given birth will get pregnant within a year. The sponge is 78% effective for women who have given birth. So 22 out of 100 sponge users who've given birth will get pregnant within a year. So what are you waiting for? Buy now, vaginal contraceptive sponge.
What is a tubal ligation? Well, a tubal ligation, also called female sterilization, is a simple permanent medical procedure that closes the tube that carries egg into our womb, making it nearly impossible to get pregnant in the future. A tubal ligation is a big step for a woman or a couple to take it perfect for those who don't want another children and have a simple permanent way not to get pregnant in the future. In tubal ligation, there are no longer side effects and nothing to worry. A tubal ligation is an important decision and nothing to neglect. You can also use IUD or implant that takes 3 to 10 years.
It's been 3 years and 6 whole months since I saw your face that night. It took 5 seconds to fall in love and 2 more to make you mine. Now it's 4 in the morning, sun setting, 7 minutes with you and it's heaven. Ain't an hour that rolls by. I love you 24/7, 365. Give you my name if you wanted to, key to my heart if you wanted to. And I hope and pray that you stay right here till we're old and gray in our last few years. I'm on a
Always use condom.
Always stay protected.